Hello guys, I know how difficult it is to distinguish between premenstrual syndrome and signs of pregnancy, especially in the very first week of conception. This becomes a hurdle for many women to tell because most of these signs that occurs in premenstrual syndrome also happen in pregnancy, especially when you've not taken any test. This is why I'm here today. I am going to enlighten you on the very classical signs that you can talk of or you can tell when you are pregnant, even within a week. Stay tuned as I take you through this. Before I get into these signs and symptoms that you can talk about when you are pregnant for the first week without a missed period, I want us to take note that pregnancy is mainly controlled by hormones, that is estrogen and progesterone. So, most of these signs that I'm going to talk about is as a result of an increase or a rise in one hormone or the other. The first to talk about is frequent urination or maturation. Why do women experience frequent urination in the early stages of pregnancy? This can happen as a result of changes in the hormonal levels and an increase in blood flow to the kidneys, thereby causing the kidneys to work harder than in the pre-pregnant state. The second sure sign that we can talk about is implantation bleeding. Guys, this has already been dealt with extensively in my previous video. Please get in there and watch it as many times as you want. And trust me, you'll be able to get what implantation bleeding is and why it is a sure sign of pregnancy, even in the earlier stages. Also, breast getting heavier and painful. This is a very common sign that women talk about when they are pregnant. Also note that the darker part of the breast, which is known as the areola, becomes darker and more deepened when the person is pregnant. The nipple could also have some soreness. If you are seeing any signs as such, kindly note that this can be a sign of pregnancy. Fatigue and tiredness is also another symptom that we can talk about. Women who don't tend to sleep more often or more frequent now begin to get tired very easily at doing certain things that they could find easy doing when they were not pregnant. Cramps at the lower back or the lower abdomen is also another symptom. This is as a result of the uterus contracting in order to expand to create room for the growing embryo. Changes in the vital signs of the woman in question can also be considered. For example, research has shown that the heart rate of a pregnant woman could increase by 10 to 20 beats per minute. Mood swing, smell sensitivity, nausea, and vomiting can all be signs that we can talk about or we can consider in early pregnancy. On this note, I want to urge every woman out there to be keen about studying our bodies. Get intentional about the unfamiliar symptoms or signs that you find going on within your body and seek medical attention for prompt interventions. Thank you and see you. Bye-bye.